On today's episode, I am interviewing Kersti Kent, the owner and founder of Medical Aesthetics of Muskoka right here in Bracebridge. We have a great conversation all about how she got into the industry from when she knew she was a kid, from the influence of her father being a doctor to now where she is as an emerged doctor, as well as she's become a dermatologist. And now she owns her very own medical aesthetics company where she can do fillers, Botox, as well as anything dermatologist related. So let's dive into this episode because there is so many great life lessons in her story.
I grew up in a medical family. My dad's a doctor, my mom's a nurse, and he was a family doctor, so he ran his own practice. So, I grew up with that whole business oriented kind of approach to work. And when I went to undergraduate, I knew I was going to be a doctor forever. I just, I was that kid that I'm going to grow up to be a doctor. And I was like, yeah. No, I'm really going to do it. So I didn't have a lot of that struggle kind of coming through university and stuff. I just knew where I was going. It was always full course ahead. And that I was very fortunate in that way that I was very easy for me to direct.
Mm-hmm.
And so I did medical school at McMaster and then residency at Queen's. And I thought I was going to go into family medicine, take over my father's practice. It would be a lovely little transition there. But once I got into medical school and started playing with the medicine and seeing what all these different types brought up, I fell in love with emergency medicine and really loved the hands-on, really loved the variety of conditions, loved the fast pace, loved the, all of those things that come with it. And so when I got to residency, pursued that. And so I did family medicine residency, and then there's an option to do a third year of extra training if you felt that would be helpful. So I knew I was going to be emergency medicine right through. So I did the extra year of training and came to Muskoka. We found Muskoka because it was the right community size. Loved the fact that they had a CAT scan. Loved the fact that there's a ton of other wonderful physicians in our community, specialists to support your care, people close by if they're not directly in your hospital. Like it was just a perfect little jewel of a place to work. And I could work full-time emergency. There was some communities you need to do some family medicine with your emerge, but here they were looking for full-time emerge. So it was a perfect fit. And certainly loved the emergency medicine, loved the pace, but then, our lives develop and change. And I mean, we had a couple kids, I have a wonderful husband, and it was just, the shift work kind of gets to a point where you think, I need to think ahead. There needs to be something else for me in this career of medicine. And so I had a very fortunate, I'm sure it was unfortunate for the person that I saw in Emerge, but I had an interaction with a patient in Emerge, and that person, as part of our just sort of conversation with the reason why they were there, I was inquiring what they did for a living, and they disclosed that they were in the aesthetic medicine industry. And so that just sort of opened up some further doors that I was always interested in beauty and looking well. And I knew I was going to do Botox and all that stuff someday. I knew it was in my future, like receiving it personally.
Yeah.
And so when that opportunity came, another provider in the community contacted me and said, I understand you were talking to one of my staff members and you had expressed interest, and would you like to pursue it? And I said, sure. I just had my first child. I was on mat leave, and I thought, well, heck, like no better time to explore something new. I have this time. I mean, you didn't really have time, but who really ever has time? And jumped right in and fell in love with it. And so that's kind of what started me on my cosmetic medicine journey.
Amazing. And then also, how long have what year did you start Medical Aesthetics of Muskoka?
Yes, I'm sure you want to know, as we have a similar name. So I was with the other provider. So I came to Muskoka. I've got all my dates here. So I came to Muskoka in 2006. And then so started doing the aesthetic training in 2009, 2013. So in 2013, I was no longer working with that other provider. So we kind of we brought the Medical Aesthetics of Muskoka into life in 2013.
Amazing. And I find that's something too that we needed in this area, was somewhere to refer people to, that they didn't have to travel like
Mhm.
hours and hours away, because like you said, we are a little gem of an area, but there is things we lack in a small community, right?
Oh, absolutely.
Yeah.
Yeah. Well, and the other thing was like the other part of my practice, which I haven't mentioned yet, is I've then further gone on to do some dermatology. And so
Hmm.
I feel that that's even was the greater need in the community is, as our nearest dermatology provider is over an hour away. And a lot of our residents are older or financially maybe can't travel that sort of distance. And, I felt people would come in for their aesthetic things and like, and what's this thing? And well, I don't know. I can take care of that wrinkle for you, but I'm not sure what that skin rash is. So I thought, I'm interested in that too. And so that opened that door, a further journey into adding the dermatology, which we started, officially started doing that locally in July of 2019. But, there was a few years of extra training that I did
Hmm.
to get me to that point.
Well, and I feel like you're always learning, right? That's the thing in the beauty world, the medical world, and a lot, pretty much every industry you think of, there's always growth that you can grow and grow and grow.
Well, there certainly should be, right? And
Yeah.
so
Yes.
like we've all probably been to places where you're like, have they changed the paint in the last 20 years? Like you just know that they're stagnant and you don't feel that growth and development. Whereas you're exactly right. Like that's what drew me to emergency medicine. So much to learn, so much to know, so much new stuff coming. And then the same with the aesthetic medicine. There's always new techniques, like how do you treat a lip? How do you fill a lip? There's so many ways to fill a lip. Learning new ways to apply, your treatments, or even in the derm world, new diagnoses, new treatment options. And you're right. Like if you gotta want to learn and you gotta want to be able to push and develop new skills if you want to be successful as a small business owner.
Absolutely. Now, to talk about the pandemic, I feel like that's something we can't really avoid in conversations
You
these
know?
days. But with the pandemic, you were still able to open because of your medical background, right? To be able to actually fulfill, like having people to still come in, right? You weren't totally affected by the pandemic that way, right?
Yeah, so we were definitely impacted for sure.
Yeah.
And so, we opened the dermatology in July of 2019. So we had a few months under our belt of running this nice dermatology clinic and getting some good flow of patients coming through. And then the pandemic landed. And so we totally closed down. We closed everything down for a month or two and just sort of took stock in how we were going to proceed, because there are, some people think, oh, it's just dermatology, it's a skin, like what's the big deal? But I mean, there are melanomas out there that can kill you. There are rashes that can really impact somebody's life. And so we thought it was important to try and get that back up to our community as quickly as possible. So we really embraced the virtual care as it came in. It was a huge learning curve. It's not something I ever had to do.
Yeah.
Um, Figuring out, how to contact patients, how to collect information, how to get the patients connected on their end. Again, so a lot of them are older; they're not necessarily tech savvy. Um, Managing risk. How can you bring somebody in safely? When should you do a telephone? When should you do a video call? And so all of those things sort of came first through the dermatology side because we recognized that was the thing that we really needed to prioritize for our community.
Mhm.
And then fortunately it naturally progressed to really complement the aesthetic side too. So I find I do most of my aesthetic consultations by Zoom or Facebook or FaceTime, sorry. And the patients love it. Like you do this laser hair consent. And I mean, I think this is an important thing from our clinic's perspective is we're all doctor directed. So you can't get a laser treatment until you talk to me. You
Mhm.
can't get a microneedling treatment until you talk to me. So because of that, it's very important that we're screening patients, making sure it's the right treatment for the right diagnosis. You don't want to put laser on a melanoma, those sorts of things. So people would always be coming in for those consultations. Well, it would take you 5 minutes to do a laser consultation. It doesn't take a lot, but it just is important to take the time. So the patients love it. They're calling me. They skip out to their car. I've seen so many kitchens and cars in the last year and a half. And they pop out, you take your 5 minutes, you get a good chat, got all your safety information, and they go on with your day, you go on with their day. And then when they're in the office, they're prepared, they know what's coming, they've had an opportunity to research and ask all their questions, and then they're comfortable and ready to go. So it's been almost like a blessing in disguise in some ways, that virtual care was probably something that was due to come just for everybody's efficiencies and convenience.
I totally agree with you because we did it with for like our skincare line that we have for like obviously the superficial like over like surface level, not as extreme as what you're doing with like getting lower than the epidermis type of
Mm.
layers, right? So we did some skincare consulting online, and it was crazy to see what people liked and what they didn't like because obviously a lot of people don't like coming in without makeup on into like a public setting. So it was great to, I mean, or they could just send us pictures. We could see different things that were going on. So yeah, it kind of like you said, it kind of forced us to get out of our comfort level in a way to learn how to do all this technology. Even for older clients, like you said, they're learning so much with the Zoom and FaceTime and everything going on. It's I think it's excelled us, but it forced us to get out of our comfort
You
zone.
had to, right? Because otherwise it was just so much easier to have someone just come in,
Yeah.
right? And then you like them coming in because they're like, ooh, what's that? What's that product? What's that thing? Right. So
Yeah,
you like them in your space for sure. But it
absolutely.
wasn't, as you say, it wasn't always the right answer for everybody. And so the fact that you could help your clients from a distance and still get them the right skincare, like you're still taking the time to
Mhm.
make sure you're getting them the right product. And I think that's a sign of a good entrepreneur, a business owner that cares, because
Yes.
you don't just want to make the sale and that's the end of it. You want people to be happy and satisfied and come back
Well,
for more. And so it takes the time.
and the follow-up too, because how easy is it to have a follow-up now? It's you can just jump on a call quickly with them and, oh, how's your skin doing after this treatment? And it's just like it seems more like a well-oiled machine. It just feels like we almost took the time, we stepped back from our businesses to see what worked and what didn't work. And then we were able to like really dial in and utilize those times and the tools we had, but we never really used them in a way. As a busy entrepreneur, I know how important nutrition is for my brain health. I know how I need to be on all the time, as well as my energy levels. Now, a lot of my energy also comes from my healthy gut, which is my nutrition and food. Now, good food, if you haven't heard of it, it's definitely a good idea. If you put in promo code Nicole 3x2, you will get 40% off or more on your first order. Now, I'm just warning you, it's a little addicting. I definitely get it every single week, and it has changed the way I am in the kitchen, as well as my productivity and time management. No more going to the grocery store. I barely have to go. The only time I have to go is for the essentials like coffee creamer, coffee, or any of those type of little miscellaneous things I might need around the kitchen. But once again, we will put the show notes below for you to get your promo code through Nicole3x2. Happy shopping, everyone. What is one of the things that you've noticed that people are jumping on board more now? Like, are you noticing that Botox is really I've noticed more people that I know in my personal bubble that have gotten Botox. I don't know if it's because of the masks now too. They're like, oh, people can see my forehead. Like they're starting to make those jumps into it.
Yeah, it's hilarious. So I think what it is this whole thing, like I'm looking at myself in this mirror. So, or in this video. And so when before we would just go about our day, we would have our meetings with other people. We weren't looking at ourselves.
Oh,
And so
I thought of that.
now that we're sitting in front of a computer and having all these meetings, the number of lip fillers I have done is off the charts. And you would think, why would you bother? Everyone's wearing a mask.
Yeah.
No, because you're not wearing a mask when you're sitting in front of your computer. And so the number of people, like, sure, Botox has always been quite popular. And yes, like a lot of women were, because for a while, the way we kind of graded, like gradually went back to full service was we opened up for mask on. And so that's really only Botox sort of eyes and forehead area. So that opened up quickly. So people wanted a little of that, so a little something to feel a bit better. But once we opened to mask off, lips, 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 like it's crazy, lips everywhere. And
Oh,
so I think people are now, they're seeing themselves face to face all day, and then they're not spending money traveling, they're not going out to eat, so they have a little bit more disposable income. So I think they're just sort of shifting their spending habits maybe a little bit into some more of our type of industry treats.
yeah. That's okay. I would have never guessed any of that until you said it. And now I'm like, wow, that does make sense.
Absolutely.
Wow, wow. Now, what is something that you do probably the most of at your clinic?
You mean overall, like from
Yeah.
the aesthetic side?
Yeah.
Is Botox is super popular. We actually use a different product called Dysport. I'm sure it doesn't matter for the purpose of the podcast, but there's lots of different neuromodulators. They're the ones that slow your muscle action down, so you can't make those 11s between your eyebrows or the crow's feet besides your eyes. So that's always been very popular, and it's probably one of the most it's probably the earlier thing that people will try. Like it's a low risk, it comes on fast, it wears off fast, it's less expensive, it's been around a long time, so people are more comfortable giving it a go. And then so fillers will always be sort of that more uh, considered, thought about. Some of it's either lips or cheeks. Very, very popular. Laser, I can't believe how busy our lasers been, despite the fact that you're sun sensitive after laser treatment. I think it's just people are tired of waiting and they're like, I'll just put my sunscreen on, it'll be fine.
Yeah.
And then of course on the derm side, it's all about skin checks and lesions and keeping people well and making sure their rashes aren't something to be worried about. But from the aesthetic side, and I'm sure you're finding now facials are blowing up, right? Because
Oh
everyone.
yeah, it's been insane. I think because people, like you said, they're putting money back into their well-being and making themselves feel better, like that self-care, self-love again. Because yes, we were stuck in our homes and couldn't do anything. We can't travel, well, for the most part. We still can't travel and do certain things. So I know a lot of people, obviously, who are affected a little bit differently with the pandemic, who have actually made more money and saving more money because they haven't been going out and doing all the things, right? So
Mhm.
it's nice to see people caring about themselves again, like really like thinking. I think it took time for people to think about what they wanted, and like you said, like maybe people, it took them a while while looking at themselves on these Zoom calls and spending time looking at themselves at home and realize, you know what, I'm gonna bite the bullet and do something for myself and treat myself.
Absolutely. Agree.
Yeah.
Yeah, it's neat. I had one client the other day, and her comment to me was she's never going to take anything for granted again. And that, like, just seeing her parents and being able to hug them or getting her hair done, like, it was those little things that we just took for granted. Like, I'll just pop out and get my hair done. And now she's like, you know what? Like, every visit, every appointment I have, like, a friend might ask me to go out for dinner, or maybe a casual acquaintance asked me to go out to dinner, and I might think, no, I don't think I'm going to. My time, I'm going to think about my time in a different way and my finances in a different way, because this pandemic has brought those reflections forward.
Absolutely. Well, my client must have been talking to your patient, because I had someone who came in for an eyebrow wax and said the same thing. I'm never taking an eyebrow wax for granted again after
Yes.
waiting so long. So, with work, how many people do you have on your team now altogether at the clinic?
Yeah. So we've actually hired 2 people since the pandemic started.
Wow, amazing.
Crazy, right? So we started back at, where's that list? So my very first employee was Mel McKenna back in 2016. So she was my first girl, and just sort of grown from there. So now we have 1, 2, 3. So I have 5 staff. So I have Mel, who's does the medical aesthetics, and Kelly, who's my other number one, and she does my nursing. She's in nursing school, but she does a lot of my dermatology procedures, laser facials, all that stuff too. And then I have 3 receptionist people. So because the dermatology, it's quite labor intensive to receive a consultation from a family doctor, then contact the patient, and then make all of those different connections happen to actually come to get a patient in your office or on the web to meet them. So yeah, it's growing again, going back and looking. And then we had a little bit of time where we did a diet program here as well. And so Christy was an amazing employee, but she had some other career opportunities come up. And so when she was done, then we just sort of put that baby to bed. So right now we've got 5 of us, and then my husband, of course, is obviously quite involved with all the bookkeeping and honeydew,
Yeah.
computer's not working, help sort of stuff, and then he's in as well to help out with that.
That's amazing. And I think it's such a great, like every time I've come into the clinic, and even like when I come in, and because my partner's been to your clinic, it's a great opportunity for people to, like, everyone I've heard, because obviously we're right down the road from each other. I'm always like, go down the street, they can help you, because if it's out of our hands, it's a great way to say, like, we work really well together and referring back and forth. And that was like for example, the other day we had someone that was in and they had something going on with their skin and we did not feel comfortable suggesting what it was. And as estheticians, we can't diagnose anything.
Mm.
So I was like, okay, you need to go down the street and give them a call and see what they can help you with. So it's been such a great relationship with both of us. Like I've been to your clinic as well, and it's been great to be able to refer people back and forth that way. And seeing the growth of your business, because I remember when you were in the other building as well.
Yes.
So now,
Little tiny space, right? And then
yeah, yeah,
mhm.
it's amazing. So, how long have you been in your current location?
So we've been here. I looked that one up too. We moved into this place September of 2018.
Wow.
So I started, as you know, but in the back of a hair salon. So once I left with that other provider, I approached a friend of mine, Joanne, who owns Scissors, one of the hair salons in town. And I said, like, can I rent a room? Like super sketch, right? Can I rent a room by the hour? And she's like, sure. So she had a room in the back where they did personal waxing, sort of like private waxing
Mhm.
area. And so it was a nice little corridor off the side that people could come in and just kind of privately sneak down the hall. And I mean, it was a very, very slow start to this business because people need to find you and they need to trust you and you need to build the experience, all of those things. And so it was literally a room at the end of the hall, and she let me use the filing cabinet so I could lock up some of my products and leave it there so I didn't have to cart it every time. And so she was amazing, and it was a fantastic opportunity to start there. And then as it grew, it became, obvious that we needed a storefront of some sort that we could just put our products out and land and be there. And so then we moved into the one across the street from you in 2016. And then in 2018 made the transition to, we bought instead of a lease, now we bought the building. We've got this lots of space now for multiple treatments at the same time. And
That
it's been a
building,
nice natural progression.
that building was meant for you too. Like it was because it was a spa before, so it's a
Was, yeah.
absolutely perfect scenario. And
It
parking,
was.
that's another thing that we get a lot too, is like actually has parking and people can come in if they have wheelchairs or not as
Yes.
mobile, right? It's such a great location. I was just thinking too, when you look at your journey, like the word of my year, I always have a word of the year, and mine was reflection. And yes, taking the time to look back and reflect. Is there anything when you were doing that, looking back, was there anything that really like hit you that was like, oh wow, I forgot about that, and I should really like honor that opportunity that I had? Was there anything that kind of hit you that was like, whoa, I forgot about that when you're doing your research looking back?
Well, the one thing I guess was there was like a business networking chamber of commerce type thing. Oh, it was a Muskoka Lakes networking. I did and that was a lot of fun. And I don't know, I guess there's probably not a lot of that going on right now, but I think that might be something that it was a lot of fun that night and just like chatting with people face to face. Oh, but that was something that, more of those sorts of things I think would be fun to do. It's just time.
Yeah.
Um, but looking back, reflecting, I really look back on, like, I tried so many things like to build this baby, right? Like, where do you start? How do you get known? And as you know, there's not a great publication in Muskoka to really advertise in. We don't really have, there's a Weekender, but it's not necessarily going to get that distribution that you're looking for. And then there's the private, like, other magazines and stuff, and they're great, and we'll probably get back into that as well. But things like you looked into like Botox parties, like, should we do parties? Should I be going to people's houses? But then there were just some sort of ethical considerations with, should you really be doing these if people are consuming alcohol? I always had a problem with
Yeah.
that, and like, it's not really appropriate to be doing medical services when someone has been drinking alcohol.
Yeah. Yeah. They might not make the right choices.
Right, like even consenting, but even, like, just, yeah, you need to be, it's a medical procedure at the end of the day, right?
Yeah.
Well, and then I went to Big Win for a couple of summers and just kind of set up in the tea room. And you know what, like, cottagers, they don't want to get work done by you. They have their person back home, right? They're at the cottage, they're there to have fun. They don't want to be bruised or have downtime. And so, it was I think reflecting back, I'm like, yeah, like, you just try things and you say, I've tried it, didn't work, moving on, as long as it's not setting you back,
Mhm.
too much time and money, you make the efforts and see what works. So I think I've sort of come to realize upon reflecting that the people will come to me. They will, you know, if you've got the skill set, they will find you, and the word of mouth will get out there, and then people will come to you. And so I just set up this clinic to be the best that this clinic could be, so that when they arrive, that we're ready to give them what they need.
Absolutely. And I think the whole pivoting thing, I think we were always pivoting in our businesses as entrepreneurs, but obviously with the pandemic, it made us have to pivot almost quicker. It was like high speed. Like it was like, okay, let's try this. Is it going to work? Try this, see if it's going to work. But I think that's the whole thing about entrepreneurship is test it out, network. And that's something I really miss is like we used to do a lot with the small business center because I did their young entrepreneur program. And it's such a great program that they offer here locally in Muskoka. I've sent so many people to do if they have a startup or wanting to run something by with all the government funding and stuff. It's such a great opportunity. Same with like the chamber events. They've always got such great, just even like going to different venues. I love, like I had been to I mean, it's crazy. I had gone to the Kita Bala for actually a business event before I actually even went there for like a party.
No way.
Yeah.
That's funny.
Like I need to come back and like actually enjoy the Key on a different level as
The
that.
party level or the
Yeah,
band or whatever. Yeah.
the different P. Instead of professional, we're going to go to the party level. But yeah, it was great. As being a local in Muskoka, there was so many things I hadn't done, but going to these events is always something like connecting and networking, no matter where you live, is so important. But I think especially in Muskoka, I sit down beside someone at a doctor's office or at the dentist or anywhere recently, and we know someone that someone else knows. Just out of the blue, you get chatting. So now with your clinic, was it easy to hire people? Like for example, your nurse, was it something that she came to you, or you put it out there that you were looking to hire a nurse, or how did that relationship start there?
So that's an awesome segue. So the story of Kelly is like my favorite story.
Okay, let's
So,
hear it.
so at this point, so we have Mel and me and Matt. And so we're getting to the point where we need someone to work the phone because Mel's busy and I'm busy. So we need someone that can be up at the front. So we we hadn't advertised, we hadn't really been looking formally, but it was in the back of our brain that we knew that this was something that had to happen. So we're out for dinner in Gravenhurst at the Orr.
Mhm.
And right, and we're having dinner, and we have a very lovely waitress. Nothing wrong with her, but there was this other waitress that was walking across the floor, and she stops and she picks up this piece of garbage and she keeps walking. And Matt, my husband, turns to me. He says, "She'd be an excellent receptionist." And I said, What?" And so his point, which because so my husband was he did a lot of work in hiring and sort of the employment part as part of his like pre-knowing me life. And he's like, you hire the soft skills. You can train a trait. You can't train someone to care. And the
Absolutely.
fact that this young woman, it wasn't her piece of garbage. She was walking across the floor. She probably had 20 other things to do, but she stopped, picked up the garbage, and went on her way. And so we went to Robbie, who owns the restaurant, and we said, Robbie, random question. That waitress, how is she? Who is she? You know, she loved her. It's Kelly. She's fantastic. Da, da, da. Well, don't worry. We don't want to steal her from you, but could we borrow her part-time possibly? And so what happened was we gave her our email and asked her to communicate that to Kelly, these random people, right?
Yeah.
And so then Kelly got back to us, and she was like, absolutely, I'm totally interested. She'd actually considered doing some medical aesthetics when she was younger and was kind of
No
told
way.
by her people, oh, there's nowhere to work in that environment. Like, think about something else. So she went to paramedic school then instead. And then realized by the placement, she's like, I don't want shift work. Like she knew early that that wasn't her end game, but she was always interested in that field, obviously. So it was just awesome when we finally connected and we explained where we were at and what we were needing. Like, we hired her as reception. Was not in nursing school. There was not any discussion of that at all. And so it just another one of those natural progressions where we started working, and then it was like, well, we could use some help in the back. Would you be interested in learning how to do biopsies? Would you be interested in learning? Because you can teach anyone to do those things. As a physician, I can delegate as long as I can demonstrate that I've trained you properly and I'm checking in often and I'm making sure you're doing a good job. So then Kelly applied to the nursing school out of Georgian, the part-time, and So it's all just working out perfectly in that I've kind of always called her my nurse, but like now she'll actually be a nurse.
Incredible.
And she's been one of the most fantastic employees that we could have ever hoped for. And then from Kelly in nursing school, we hired our most latest hiree, Ruth, who's one of her classmates,
Oh,
um,
exciting.
who's just lovely. And then my other hiring story is Monica Hastings. So Monica is my hairdresser,
Yes,
and
yes.
I've been in.
Check it
I'm
out.
youthful again. So Monica being a hairdresser, as most people will know, it's kind of like your esthetician or your bartender, right? You're just kind of, your fingers on the pulse of the community, and she's from Muskoka as well. And so we hired our two other employees on the suggestions of Monica. Like, we interviewed a couple other people in there as well, and sort of asked a few other people that we knew, do you know anybody who might work well with our team? But we are very protective of our team environment. We feel like, let's hire people once, not have to keep rehiring. And so we almost consider our team like a family. We always, whenever we're going to make decisions about the clinic, we're talking with our staff. We want to see, will this work for you? What's your feedback? How's that been going? Please, like, don't be afraid to come to me and say, this is crap, like, this is the worst idea ever. Like, I want to know, because I'm not at the front. I'm not answering that phone. I'm not dealing with patients directly.
Yeah.
If that's not working for you, if there's a better way, I want to hear. I want to know what your suggestions would be. And that's some of the feedback I've had from my staff, is they love the family environment. They love that they can come to me and not feel like they're walking on eggshells if something's not happening. And if they make a decision, like if someone calls in and they make a decision about, like, this is the answer I gave that person, then we support them in that. And we say, yes, like, if that's what you said that we were going to do, then we will honor that and we will stand by you, so you can feel like you can continue to make these decisions. So
That's amazing.
we've just been incredibly fortunate with all of our people, that they've just really clicked well, and they get along, personally, and then also within the business environment as well.
Absolutely. And I think you can feel that energy. That's something that as soon as you get into a space or an environment, you can feel that in the energy in the space right away. Like, as soon as you walk in that door, like I know some of the women that work with you or work for you, and it's like they enjoy their job. You can completely see that. It's so transparent in the way they speak, the way their body language is, everything, and their energy, even when they're outside of work. If you're a busy person like most of us and forget to take your vitamins every morning, Cara Vitamins has made it extremely easy to remember. What I personally do is I just put the box beside my coffee maker, because we all know I can't forget my coffee in the morning, and I make sure that my everyday vitamins are ready to go, either if I'm on the go and/or I throw them in my purse. It's a great way to keep them all in a compact space, as well as keeping your cupboards and cabinets clean and simple. Now, with my promo code capital NME7GR, you will receive 50% off your first order. Now, another great thing I love about this business is they really care about you. Now, when you go online, they're going to ask you questions of why you need vitamins or what you're really needing in your everyday life. Personally, we all need a little bit of extra energy, maybe some extra magnesium, things like that. And this is a great way to keep the questions out of your mind when going to the grocery store and/or a drugstore to pick up your vitamins. Now, once again, that promo code is capital NME7GR for 50% off your first order.
So when I started out, it was more of a, how do we get a website? How do we connect with people in a more modern way? So, I would like to hope that when people walk through the door, they go, wow, like, this is a doctor's office. And you say, well, yeah, that doctor's offices don't have to be beige and smell bad. They can be pretty, and they can make you feel good when you come in. And so I think that's what we've been experiencing in the feedback with patients.
Absolutely. Yeah. Well, and even with even when you walk into your space, the beautiful blue that you have, and even the natural wood shelvings and things like that, it's beautiful because you've got that touch of Muskoka in there without making it like, there's obviously Muskoka where it's like
so kitschy.
Yeah, like the whole
Yes.
like cottagey, like the real cottage vibe, obviously, but it's like a beautiful touch. Like, it's clean, sanitized, obviously a safe place to be, but you've got it where there's like a little bit of that Muskoka flair in there. It's just beautiful.
And that was by design, absolutely. So I appreciate you noticing that. Yeah, we have like live edge desktop and shelving and lots of barn board everywhere. And it's just been it's a nice place to work. You feel good walking in, coming in from the emerge environment. You get that contrast of calm
Yeah.
and happy and clean and no unexpected things are going to pop up. It's just, yeah, it's been a wonderful opportunity.
Amazing. So when you were little, like you said, you always knew you were going to become a doctor. You just knew when someone asked you as a kid, what are you going to be when you grew up? You always knew.
Yeah, absolutely. Yeah, my dad, he jokes he tried to talk me out of it, but he would he would take me on rounds to the hospital and we'd walk around and I'd say hi to his patients and they were always so happy to see him. And I thought, yeah, this is awesome. And then had the opportunity to work for him when I became of an age that I could, do reception for his office and really loved that side of it too. And talking to the people, not necessarily knowing the medicine behind it, of course, or at the front, but you got that vibe of what it was about. But yeah, it was going to be medicine forever. I don't know why. Maybe I just saw it and I just saw how my dad was, how he enjoyed it. And it was always bugging my ear. It was going to be medicine. I my backup plan, like, what am I going to do if I don't get in? Because,
Yeah.
I applied to medical school 3 times. So this is something everyone thinks, you just get up, you apply to medical school, you go to medical school, da, 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 da. But a lot of people, and people don't want to talk about it because it's embarrassing. Oh, you weren't like the smartest person in the world. Well, no, I'm
No.
not. But and so I applied 3 times. And so as you get to that third, you're like, well, I don't know how many more times I'm going to apply. I probably should get on with life. And if this isn't going
Yeah.
to happen, what's the backup plan? Right. So I myself was thinking about paramedic school because again, that would be medical and helping people in acute care. And so, and I probably would have pushed that to do more of like an advanced care paramedic, like take that as far as I could have gone. But fortunately the stars aligned and that third application year, I got accepted to McMaster and the story writes itself from there.
Good for you to just keep driving and moving forward with that, because like for example, I always kind of knew I was going to get into the beauty world, but like my mom was a hairdresser. I knew I did not want, like, my hair's naturally
Yes.
curly and a mess half the time anyways, but I was like, I do not want to get into hair. And I always wanted to get into aesthetics, but like I went and started my real estate license. I wanted to work for Hydro One. I went and got my chainsaw license, all these random things. And I was like, okay, maybe my mom was right. I should just get into the beauty world. But it was things that I was like, it just kind of naturally worked its way out. But to your point of like trying and trying, I didn't think I was even I took biology in high school and I got a 51. I was like, how the heck am I supposed to learn about the skin? How am I supposed to know all these things about the body when I got a 51 in applied biology? But then you
Yeah.
teach me how skincare products penetrate into the skin and how like the different layers of the skin work and hair growth and waxing and all this stuff. I'm like, okay, I'm actually interested. I'm going to listen
That
now.
makes sense, right?
Yeah,
Exactly. Like you don't need to necessarily know how a cell divides and like how many, what the chromosomes are doing. Like who cares?
exactly.
You need to, yeah, absolutely. Yeah. So that is, pushing and, driving and grinding it out, right? It's like grinding it out. And whether it's like I'm grinding it out in a 5-minute match on the floor of jujitsu and I'm just like dying and I'm like, well, don't physically die because that would be a bad outcome. But like you push and push and push and you just grind and grind. And it's uncomfortable. Like it's something I'm teaching my girls right now. It's like when you are exercising, for example, it's going to be uncomfortable and that's okay. You
Mhm.
need
I like
to you need to embrace that discomfort and know that it gives you growth and development when you're feeling that. And so I find the same has been through my career. Like when I, had this aesthetic gig on the go and I'm in Emerge and I kind of know what I'm doing now. And well, maybe I should do derm. Wait, what? Like, so for derm, it was an online, like a postgraduate diploma. So this was like a $16,000 like diploma course. Like it was like a whole second job that I was doing while I was working full time in the Emerge, running my aesthetic practice 2 days a week. And for a while, I worked at a spa at a Barrie at one of their medical people. So
as well as being a mom and a wife on top of that
exactly,
too,
exactly.
right?
Now, to be fair, my husband does a lot of the domestic duties because A, he's excellent at it, and B, he cares to do it. But for sure, like I could not have done it if I hadn't had his support. Because how do you take off for as part of my dermatology training, I kind of had to do like a mini residency. Well,
Oh,
I went
yeah.
to so this is mandated through the college. So the way it works is as a family doctor, you can kind of do whatever you want, as long as you can provide that you have training to do that. So if you're a GP and you worked like in the north, you could learn how to take gallbladders and appendixes out and stuff, and you could totally do that if you were trained to do it. So the same goes with dermatology, is you need to, you know, get the training and then demonstrate that you are safe to, in fact, practice in that place of medicine. So the college mandated supervising. So I had to do 4 weeks of high level, 4 of medium, and 4 of low. So, and then you have to come up with your individualized education plan, and you go back and forth and like, what does this mean? And what is high? And they didn't have any guidance for me. They didn't have any documentation to suggest, we'll start here. And I had to develop it all from scratch. I had nothing.
Wow.
So what it came down to is I had 8 weeks where I had to do direct supervision with a physician, non-paid, like you're working there, but you're not making any money and you're getting supervised and they're signing off on you. So I went to Sudbury for 5 weeks, not consecutively, but 5 months. I would drive up to Sudbury, stay for the week, work with the greatest dermatologist in the world, Dr. Giroux, up in Sudbury. And I did 2 weeks in Peterborough. And then I did 1 week with Dr. Jessica Reed in the OR here, as doing lumps and bumps. So that was nice as well. So that was 8 weeks where I was not at home and not able to help with the family side of things. That was a week where I wasn't able to work in the emerge. So all those hours that I needed, I had to make up in those other 3 weeks. So that's another 3 weeks where mom's not really all that around, because now she's grinding out the work part of the requirement. Because in our family, I am the only, income earning person. My husband doesn't work outside of the house. And so if I'm not working, there's no income. And so, it's just, as a small business owner, I'm sure as people who are in businesses know, you just push and grind and go, because no one else is going to do it for you.
Yeah, absolutely. And even time management, right? Like that's the biggest thing. I look at, like, I feel like both you and I are very similar. Like we like to be busy. That's just like our nature. And I have a couple of friends that are now getting into the entrepreneurial world, and they're my age or older. And I'm like, either you got it or you don't, in a way. Like you gotta be hungry for it. There's no, someone's gonna save you when you're staying up till 2 a.m. doing paperwork that you dread doing, but it has to be done, and you're not gonna have time tomorrow to do it. You just gotta do it. So, and that's something where for me, like I don't have children right now, but it's something that I do hopefully in the future have. And it's a tricky transition, I think, as a female entrepreneur, looking at those different stages you go through in your life and deciding what is the best for yourself as well as your whole family at that point. Were there those conversations that obviously you and your husband had of like, okay, this is the direction we're going to go in, how are we going to make this work? Was that kind of before kids came, or was that kind of as you were flowing through these transitions of your career?
Yeah, I mean, we're good communicators. When did we get married? I should know this off the top of my head. When did we get married? Married in 2004, right? So like we've been together forever. So obviously when he proposed to me, he knew I was going into medicine, and I was in medical school. Like he knew that if he went into teachers college, so he's a teacher by training, but has never had the opportunity to work because I keep dragging him around everywhere. So, and then we had kids, and he was like, well, no, I can't. So,
during the pandemic, he could teach them at home. He knew what he was.
Oh, sure, yeah. So no, so that was sort of something interesting. So it was communicating through that, and then when I was in emerge and wanted to start the aesthetic, and the baby had just been born, right? And so he's like, well, if you're interested in it, go for it.
Aww.
And then it was just like once a week I'd just go and observe, and then, well, I think I'd like to do the training in that. Okay, well, how are we going to make that work? And then it was, okay, well, that didn't work out, but I want to go to, now I've got this opportunity to go to Barrie and work at the spa and get lots of experience. And so I think when it came down to the derm, I was probably the one most on the fence. And my husband's like, now is the time to do it. The kids, they don't really have anything to do. This was like 4 years ago. So like 8 and 6, right?
Yeah.
So like do it now, because you're not missing out on really anything big. You don't want to do it when they're like in their teens and they have some like high level competition at something, and then you're like, well, no, I can't go because I'm studying for this or whatever. And the timing just sort of landed, and it was like, let's do it. And then I think at the end of the day, it it worked out well for the timing of it all, because we couldn't have really done it during COVID.
Yeah, true. Yeah.
And it would have been a lot more difficult. So yeah, we're obviously always communicating. It's got to be a two-way street, because he is the core of the family unit at home, and making sure that all functions properly. And so I don't want to spring too many surprise things on. A few every once in a while, I'll just keep him on his toes. But
yeah, I was just gonna say, you got to keep things interesting, so keep them on your toes. Exactly. And that's what I say. Like, and my dad always said that with us, with having boyfriends and stuff. He was always like, as long as you have communication, that's key. And now to being in the relationship I'm in right now, even when it comes to employees, like you said, having that door open to, it's okay to have that conversation, whether it's something that might come up. Like, we always have our assessments and things like that with our staff. And one of the things I'm going to be asking them in our assessment at the end of August is, what do you like and what don't you like? And leaving that door open. And I was reading this really interesting book, and they were talking about leaving the door open, but letting them speak. So you reserve yourself, even if it's awkward, don't talk. Make them have to answer the question without like warming up the idea of how they're going to respond. So that was something that I really learned from my dad growing up as a kid. He's an entrepreneur as well. And then now taking that into relationships as well as friendships, professional levels. It's such a great way to just make sure to have that conversations and that communication around what's going on. And not having, like you said, you got to have surprises here and there, but for the most part, having it laid out so they know what's going on.
But I think communication just across the board, like when our clients dissatisfied, I find most of the time it's been a communication issue. Because even if you do a procedure and something untoward happens in that procedure, if you are open with them, you're communicating with them, you're supporting them, you're calling them, you're making sure things are going well, they appreciate that. Like, they don't blame you for the side effect. Well, maybe some would, but most of them, they just want to be heard, and they want to know that you care, and they want to know that you want to help them.
Yeah.
And so for us, that's super high priority for me. If anyone calls in and has any concerns or problems with things that have happened, we're calling them. We're touching base with them the next week. We're providing them with support, documentation, sending them products that might be assisting them, like those sorts of things. And so I found over the years in medicine in general, and especially in the emergency department, right? You get that little phone call from your department manager to say, we've had a complaint. And then you, not too frequently, but sometimes.
Yeah.
And so you review the case, and you know what, like almost 100% of the time it's a communication issue. Whereas if you just explain it a little differently, or you're having a bad day and maybe you're a bit short and snappy, right? Well, they're obviously having a bad day. They're in the emergency department. And so you'll learn over time that, communication, whether it, like you say, partners, staff members, family members, clients and patients, we have to really be on our game with our communicating and being receptive to what they're saying, acknowledging what they're saying, and then, making the decision of whether, you accept or not what they're saying. But if they feel like they're heard, I agree. Like, everyone has a nicer experience when they feel like they're being listened to.
And not being a number, like that's something that I felt like I've done a lot of reading in this pandemic, because what else are we supposed to do?
Why not?
And exactly. And that was one of the things, is like treating services, whether someone's going into a boutique store or like a natural service industry like we are, and making them feel like it's not just a service, it's an experience. And really in turning that into everything from how you greet them at the door to that reminder phone call or anything, really, right? Like every touch point is that communication and how you're making that client or patient feel at the end. Muskoka Beauty wants to thank everyone for listening to our podcast. And we're offering 15% off your first bottle of Lash and Brow Serum by Muskoka Beauty. Now, if you haven't heard, or if you haven't tried or seen before and afters, or even seen reviews, you're definitely going to want to head to muskoka.com and click onto our lash serum to actually read some of the reviews, because this product is unbelievable. It will enhance your natural length and your brows as well, making them more full and absolutely gorgeous. So head over to muskoka.com and type in promo code Beauty Brand Podcast 15. Once again, that's Beauty Brand Podcast 15. Happy shopping and happy lashing. So to close things off for the end of this episode, this has been amazing. And I feel like I haven't actually like sat down and had a conversation with you like this before. I'm always like, oh, we
do
need to
this
sit down or whatever, right? It's nice to actually sit down and actually hear about your story from the start to where it is now. So if you could give advice to someone listening to this episode of whether they're wanting to get into the medical, kind of like the medical cosmetic world or even into dermatology, what is something that you would suggest and like get kind of their gateway into getting into the industry? What are some of the things that really resonated with you?
Yeah. So dermatology, you're gonna go to medical school and do all that. So
Yeah.
study hard, do a lot of electives in derm because it's really hard to get into now. But I guess as far as from the aesthetic side, and I do have some medical colleagues who have thought about adding that into their practice. The one thing is you really need to commit to that part of your practice. So you don't halfway, you don't have a day of like baby checks and blood pressure and diabetes and then throw a Botox here and there, right? Like you need to make that day, and that goes with the flow of like the patient enters and there's not kids running around sneezing and screaming. They come into this beautiful, blissful environment and they're walking through and having that positive stress, decreased stress experience with the whole scenario. So you really have to go all in. And so that's hard for a lot of people if they don't have the support staff to do that. It can be expensive to, dive into technology. So we have one laser, and that was our big technology purchase, and it's amazing. But I would say to people, you don't need the technology out of the gate, right? Start with your bread and butter, start with your facials, start with what you're interested in, right? That's, I guess, the first and foremost would be, what are you passionate about in that industry? Absolutely. And dive into that. Do conferences. There's going to be more opening up, I'm sure. All of the aesthetic companies are more than happy to send you trainers, send you samples, send you things to play with. Take them all. Take all of them. Take every free learning opportunity that lands in your lap if your time will allow you, and just learn and learn and learn and learn. And then, just talk to colleagues. Find some mentors that you can communicate with and bounce ideas off of. And, oh no, I've tried that, it was a nightmare, or well, that was the best thing I ever did. And like, there's no reason why you have to reinvent that wheel. Like, there are most people in this industry are more than happy to talk with other people in this industry to provide help. There's more than enough gravy to go around for everyone. I don't need to corner this market in Muskoka and have every Botox needle coming from my hand. So we need to support each other as small business owners, as women. We need to see each other as colleagues and not competition, because together the tide lifts all boats. We need to lift each other up instead of just trying to take away from each other, because we have this notion that we can't all win. It's not a zero, a net zero game here. We can all succeed together. And so, that's the one thing. I'm trying to see, I've jotted a couple of other things maybe down. And the balance, like, I think that was a big thing too, is just recognizing that, yes, it takes a lot of work to open a business and then persist with that business and continue for it to be successful. But always remember where you're coming from, and remember those other people that matter in your life, and make sure you can maintain some sort of balance, because then it just won't be worth it if you're just dog tired and feel like everything else is suffering behind the scenes.
We are so fortunate in the Muskoka area about how many women in business we have. I'm always mind blown. Like, even with the podcast, we're taking a little season break after, but I'm going to try to get more local businesses on, because it is just mind blowing to me how many people we have in like the Muskoka Parry Sound area, and even just women in business in general. But I feel like there's this new segue of women that are now business owners that are lifting each other up. It's not that dog eat dog world kind of, it's really changing and revolving, which I'm loving that. And the collaborations with other businesses that have been going on, it's just amazing. So I'm so glad we got to sit down and have this conversation today. And I think it's one of the biggest things that like you have touched on so many positive things with like your career and never giving up, even though like with the medical industry too, there's changing, revolving growth. Like there's so many things, balance, having that support system, whether it's your spouse or even your community behind you, as well as your staff and employees. Like I applaud you on every level. You've done amazing, and definitely someone I look up to in the industry in Muskoka. So you're doing amazing, and I can't wait to see where you're at in years to come.
Well, thank you. I've always appreciated your support as well, like helping us when our steamer dies or like our
Yeah.
patients show up at each other's place. Like,
Yeah.
don't cut yourself short. I think
Yeah.
you've been a very helpful person in my career development as
Yeah.
well, because you've dabbled in it as well, and so I think I do appreciate the support
I forgot about that steamer. I forgot about that. When you were called, you were like, oh, do you guys have an extra steamer kicking around? I'm like, yeah, actually we do. So that's
and like we're here for each other. You can be like, nope, not giving you the steamer. You can send them over here for the facial, right? Like,
yeah, yeah, it's all comes around. That's a great thing I love about it. And even in jumping on and having like, oh, I need help with this, or what's this suggestion, or even clients who might need something as well, right? We're always here for our clients and our patients as well. So thank you so much for spending time with us. I know you're super busy, and I really appreciate it, Kersti. Thank you.
wonderful. Well, thank you very much, Nicole, and continue kicking butt over there.
You too. And we'll chat soon. Thank you.